So Dr. Botha, why is testosterone important in men and women?
So testosterone is important because when we're younger, our levels are good, and as we age, they decrease. So it's really important for our muscle mass. It's important. It decreases visceral body fat. It decreases inflammation. It improves our exercise tolerance and helps and enhances well-being. It improves our skin quality. It improves our libido, our sexual function, and it really decreases disease of aging. So it's actually one of the most important things. And if we replace that, overall quality of life improves.
So Dr. Botha, when should men and women consider replacing their testosterone?
So that's a great question. Women, we tend to peak with our testosterone at 21. By 25, the levels have plateaued and then generally drop in our 30s. And women are scared of hormones. Part of it is we equate birth control pills with how we're going to feel with hormones. And one of the things that birth control pills do is they increase proteins that deactivate our intrinsic testosterone. And testosterone really allows us to exercise, and it allows us to increase our metabolism. It also makes us feel good. Men typically drop in their 40s. So women really need to start replacing our testosterone in our 30s, and men in 40s in order to improve overall wellness and decrease inflammation.
So what about some misconceptions out there that testosterone increases your risk of blood clots or strokes, or really masculinizes women?
I love that you asked that. Honestly, I feel like that is something that us in traditional medicine really have a misconception. We do not understand that there's a difference between bioidentical testosterone and synthetic. So synthetic testosterone is not the same as bioidentical. Bioidentical means that it mimics our body's natural hormones, and it does not increase risks of stroke or blood clot. So testosterone actually, especially if it's in a good form, so transdermal, which means creams or pellets, actually improve your lipid panel. So they decrease your LDLs and increase your HDLs, and do not increase risks of stroke or blood clot. Do not masculinize women when the dose is appropriate for a female. So we don't do very high doses. It just has to be above physiologic value for women to feel good. And the ones that actually do increase risks are ones that a lot of people are on, such as injectable. Injectable testosterone has been shown to be much more inflammatory and increases risks of LDL and HDL. So it negatively impacts the lipid panel. So testosterone in the form of a cream has a really good half-life, and testosterone in the form of a troche only lasts 3 to 4 hours. You don't want to take testosterone if you swallow it, because that definitely increases risks of blood clot. So if testosterone is given in a form that is transdermal, which means that it's not something that goes through the liver, it really does not increase risks. It only has benefit. And Rebecca Glasser is a surgical oncologist who has incredible data that shows a decreased risk of breast cancer. And so we know that both breast and prostate, when you do testosterone, is protective and decreases overall cancer risks.
So then what kind of patients do you see in the office typically, and what do their treatment plans look like?
So I actually see men and women. I treat families, and I see both young and old. I see anybody who is frustrated with the way they feel and really haven't had answers. So I welcome everybody, and I love to treat the whole person. So I like to bring patients in. I always do a consult, I do labs, and we make sure that everything is looked at, because it's not just our hormones, it's what we eat, it's our inflammation, and it's our vitamins. So here at Mooi Med Spa, we're very comfortable taking care of everybody.